What is the role of soda in stone formation? Hi, my name is Mahita. I'm a fourth-year urology resident, and people have requested that I talk about this topic, but also there was a recent case in which a patient drank up to 3 liters of Coca-Cola a day and was found to have a bunch of bladder stones. In 2013, there was a study that looked at about 200,000 patients and found that people who consumed sweetened, sugary drinks had a 23% increase in stone formation risk. There was also a study in 2018 that looked at men who consumed fructose on a day-to-day basis and found that they had increased levels of oxalate in their urine as well as uric acid in their bloodstream. So what is it about soda that increases your risk for stone formation? So soda has 3 main ingredients. 1 is high fructose corn syrup, 2 is phosphoric acid, and 3 is caffeine. High fructose corn syrup causes an increased level of uric acid in your body. Anytime there's an increased acid load in your body tries to hold on to base to buffer that increase in acid load. This is how your body maintains its pH. One of those potent buffers is called citrate. But citrate is also a potent inhibitor of stones when it's excreted into the urine. So the more acid your body has, the more buffer and citrate that your body holds onto, and the less citrate there is in the urine. Less citrate in the urine means that your urine has a higher risk of forming stones. High fructose corn syrup also breaks down into oxalate in the urine. So the higher the concentration of oxalate in your urine, the higher the risk of forming calcium oxalate stones. The second ingredient, phosphoric acid, has a similar effect on the body. The higher the acid load in your body, the more it holds on to buffer, particularly citrate, and the less citrate there is in the urine. The third ingredient, caffeine, is more of an indirect effect. Caffeine is a diuretic, which means that it pushes water into your urine, which is great at first, but folks who often drink a lot of soda do not drink water. Drinking coffee and tea as a source of caffeine has actually been shown to reduce the risk of stone formation because you're also drinking a lot of water with your coffee and tea in a way that you're not when you're drinking soda. So over time, soda-only drinkers get very dehydrated. Your urine becomes very concentrated, and the more concentrated your urine is, the more opportunity there is for the solutes in your urine to stick together and form stones. Now, does this mean that you should never ever drink soda ever again? No. This is just to say that everything in moderation, and keep in mind how much fluids you're taking in because not all fluids are equal.